Get informed. Get educated. It's all about your health. This is Healthy Living with Dr. Lateef Akinola.
Hello, I'm Dr. Lateef Akinola, consultant obstetrician and gynecologist at Medicine Specialist Women's Hospital based in Lekki, Lagos. Today I want to talk about endometriosis and fibroids. These are two chronic diseases that are very common in women of reproductive age. In our environment, it's one of the diseases that we see all the time. Let's talk about endometriosis first. Endometriosis, of course, is a chronic disease where the endometrial lining, the tissue that lines the womb, are found outside the womb. It could be on the ovaries, in the pelvis itself. It could be on the uterus itself, fallopian tube, ovaries, urinary bladder, and bowel. This disease is very chronic and it causes extreme pain sometimes. And of course, treatments are not far-fetched. But however, it's one of the most difficult diseases to completely eradicate. In fact, there is no treatment for both conditions. There is no cure for both conditions right now. Endometriosis diagnosis could be prolonged, especially when confused with diseases like fibroids, chronic pelvic pain, pelvic infection, and of course, infertility. Endometriosis can be treated. It's a treatable disease, even though we don't have any cure for it right now. One of the first line of management is to relieve the pain, give pain relieving tablets, including simple analgesia like paracetamol, ibuprofen, or any other non-steroidal analgesia when the patients are not allergic to it. If that is not working, we could consider giving hormonal medication, including controlled oral contraceptive pills and progesterone tablets. This could give a lot of relief and could, also lead to minimal progress in the disease. If this is not completely working, we could change to hormonal gonadotrophin releasing hormone antagonists, including elagolix, relugolix, and linzagolix. These are specialized drugs that could lead to significant reduction in pain, improved fertility potential, and of course, improve the quality of life of the woman that's prescribed, with these drugs. Surgery is not a last result, but if it is necessary, we have to do it, especially when there are protracted severe pain, chronic infertility, and surgery includes laparoscopy and robotic-assisted surgery. These are commonly available anywhere in the world, including Nigeria. And if you are one of the patients that need this kind of surgery, please reach out to us. We could see you on time, and then, of course, channel you along the management line that will improve your quality of life. Emerging treatments are available, including stem cell therapy and exosome therapy. Immune modulation is also available. And of course, microbiome-based therapies are also available. These are not easily available, and some of them are even at the research level. Talking about fibroids, of course, both endometriosis and fibroids can be found together, and one could complicate the other. Which one comes first is open to debate. Fibroids are also a chronic disease very common in women of African origin. And of course, we all know fibroids can lead to swelling abdomen, painful menstruation, severe menorrhagia, and heavy bleeding during menstruation. And of course, fibroid is also treated easily with medication to relieve pain, hormonal drugs to control the size of the fibroids, including gonadotrophin-releasing hormone agonists, Zoladex, Lupron, that we all know very commonly, and some of the patients are already on it. And they can give rise to significant reduction in symptoms and can improve fertility as well. If that medication or medical treatments are not helping, fibroids can also be treated by open surgery, minimal keyhole surgery like laparoscopic surgery, robotic assisted surgery, and of course bladeless surgeries are also available like IFU. Fibroid embolizations are also available. These are treatment modalities that have advantage, and of course they have their pros and cons, as I said. And if you are one of the patients that are afflicted by this disease, we are here to assist you. Please reach out to us at Medicine. Thank you for listening.